Hello, my name is Amber LaRock and I am a staff writer with Emergency Vets USA as well as a licensed veterinary technician. Our goal at Emergency Vets USA is to educate you on topics regarding your pet's health. So today we'll be discussing hookworm anemia in puppies. Unfortunately, hookworms are an extremely common intestinal parasite in our growing canine friends, and many people are unaware of the serious medical complications that can come along with a dog having hookworms. So today we'll be diving into the details of hookworm anemia and helping you better understand how to keep your puppy safe going forward. Hookworms are an intestinal parasite that reside within your puppy's intestinal tract. Unlike other intestinal parasites, hookworms actually have a hook-like mouth that allows them to latch on to the lining in your dog's intestines. So this is very concerning for a few different reasons. If your puppy has a large hookworm infection, these hookworms can actually consume quite a large amount of blood to the point of causing hookworm anemia, which basically means that your dog has a low number of circulating red blood cells in their bloodstream. So not only do these hookworms consume your puppy's blood, but they also inject an anticoagulant when they are doing so. This allows them to take in a large amount of blood without it clotting, but what this also means is that the area will continue to bleed after the hookworm moves on to a new spot. So this again can contribute to a puppy's anemia. Putting the potential for anemia aside, a large hookworm infection in your puppy can lead to a large amount of intestinal inflammation. If you think about it, multiple hookworms hooking onto multiple different sites along their intestines will lead to serious irritation over time. What this will do is not only be extremely uncomfortable for a dog, but it will further irritate some GI symptoms that they are likely already experiencing. So they may continue to have violent diarrhea, vomiting, bloody diarrhea, may even have black tar diarrhea, which is evidence of digested blood in their stool. So not only can puppies develop life-threatening anemia due to their hookworm infection, but they will also struggle with severe GI upset, which can in turn lead to significant dehydration. So with dehydration and life-threatening anemia on the table, this just shows how dangerous it is for your puppy to have a hookworm infection. So diagnosing and treating the hookworms in themselves is really not that challenging. It's very easy to diagnose hookworms. All your veterinarian or veterinary technician has to do is collect a fresh sample of stool and look at it under a microscope, and they will scan for the presence of hookworm eggs. If there are hookworm eggs on your dog's fecal float, your veterinarian can prescribe a dewormer that will kill the hookworms in their intestinal tract. Depending on the degree of their hookworm infection, your puppy may need to take this dewormer for anywhere from 5 to 10 days. It really just depends on how many eggs that were seen on their fecal float. It is important though to deworm your dog once again in 2 to 3 weeks, just because this will give the dewormer a chance to tackle any newly developed adult hookworms. Things do get a bit more complicated if your puppy is taken into the animal hospital with life-threatening anemia. Aside from treating their intestinal parasites with deworming medication, your veterinarian may even suggest a blood transfusion if needed, if their PCV is low enough to warrant it. So we always just suggest trusting your vet's guidance in this situation. Every case of hookworm anemia can vary in severity. Since these cases can vary from pup to pup, we always just suggest speaking with your vet in detail about what is best for your puppy and what will offer them the best chance at recovery. For a more in-depth review on hookworm anemia in puppies, be sure to review the article that is attached to this video, but stay tuned to Emergency Vets USA for more topics on pet health.